Hi, do you know what the #1 misconception is when it comes to families setting boundaries with someone they love in active addiction? Hi, I'm Kimberly Velez. I'm a licensed mental health counselor in the state of Florida, and the #1 misconception for families is in regards to setting boundaries with their loved one in active addiction. And the reason that is because most families has been afraid that their loved one will feel like they're abandoning them. And this is why I decided to create a YouTube video about this topic, because it's so critical and important. So here's the main 2 reasons why families tend to believe that they're abandoning their loved one when they're setting a healthy boundary. So the first main issue for families is just really that it's something different for you. You are saying no for the first time, you're not doing things that you've typically done before to reduce your discomfort. And we're human beings and creature of habit, and one of the things we do not like to experience as a human being is feeling uncomfortable. So everybody has their own reason how they respond and react to their loved one in active addiction. This is really where a skilled clinician can come in and help support the family in addressing their own individualized needs, especially when it comes to managing their emotions in new ways. So again, this is something very emotional. We can't get more emotional than watching someone we love self-destruct. So when we're feeling a level of discomfort, when we're feeling a level of anxiety, when we're feeling fear or scared or lonely or worried, we will find the quickest way to alleviate ourselves of that. So 9 times out of 10, when it's families dealing with their loved one in active addiction, they've been alleviating it by possibly enabling and rescuing and not saying no perhaps when they need to, and definitely by tolerating behaviors from their loved one that they normally would not accept from anyone else. So again, it's really critical to get help and guidance and understanding that about yourself, and then being taught or shown or practicing new coping mechanisms to still manage those emotions, because they're still going to be there, especially when you start saying no. The second reason why families really struggle and feel like they're abandoning their loved one is because your loved one doesn't want this to happen either, and it's different for them as well. And what that really means is that you have to remember you're dealing with someone in active addiction. They're not in their right mind. They're not rational thinkers in active addiction. When families have come to me in the past saying, you know, Kim, we're really worried because she doesn't want us to do this. She feels like we don't love her. This is what she said to us. You know, I really point out that that's emotional manipulation, because in no way, shape, or form are you abandoning your loved one. You're setting up different limits to behaviors that you're going to accept and tolerate from your loved one. That's all that's changing. So they tend to not want that kind of support, and they will do anything and everything they can to really try to get you to revert back to the old ways, because the old ways enabled their addiction. It enabled them to get away with things that they shouldn't. It made their drug use easier, more comfortable. And this is what families do not want to do. So it's really, really critical that you all, again, get help and understand for yourselves, what are your emotional hooks? How are you triggered? What are the things that your loved one says or does that really gets to you? And then how are you responding? You know, do you just throw your hands up? Do you feel powerless? Are you feeling frustrated? Are you scared? Because most of the families I've worked with are terrified to set a healthy boundary for fear that their loved one will pull away even more from them. Your relationship that was there prior to addiction 9 times out of 10 is not the same. So families are really scared to set a healthy boundary for fear of losing even more of the relationship that's really non-existent at this point in time. So these are the 2 main issues that families really, really struggle with. And again, it's so important for you guys to get help. You cannot possibly navigate and manage crisis after crisis by yourself. There's resources out there that can help you. I have down below a link to the top 3 resources available to families. Please click on it, it's free, and start your path in getting the help that you need so that you no longer fall under the misconception and misguidance of feeling like you're abandoning your loved one by setting up, I call them recovery supportive boundaries. That's what you want to do. We don't want to do anything as a family that fuels the addictive cycle. So again, implementing and following through with recovery supportive boundaries, that's what families need to do. Please get the help to start understanding what that is.